A health alert this Friday after the U.S. declared monkeypox a public health emergency. More than 6,600 cases have been detected in the U.S. since May. That's up from 5,000 last week. 454 cases in Texas, nearly half of those in North Texas.
We're prepared to take our response to the next level in addressing this virus, and we urge every American to take monkeypox seriously.
As for vaccines, more than 5,000 doses just arrived in Dallas. And while the vaccine is only approved for people 18 and older, the FDA says some children have received shots on a case-by-case basis. I want to bring on our medical expert, Dr. David Winter from Baylor Scott and White Health. Dr. Winter, we've been talking about monkeypox for a few weeks now. We're wondering, what is the difference? How can you tell the difference between chickenpox and monkeypox, especially as kids go back to school?
It's a good question. Chickenpox is different. The rash is different, starts a little bit different, and it's more of a diffuse type of rash. Now, the pox skin lesions can look about the same. Monkeypox, though, they tend to be a little bit bigger, fluid-filled, kind of pearly looking. We're not seeing a lot of chickenpox right now. We're seeing some monkeypox, 5 cases actually in children in this country. So just be aware that if folks have any kind of skin lesion, be careful and do not touch that lesion, because that's the way we spread monkeypox.
Now, as kids head back to school, and a lot of parents are thinking, what can I do to minimize the chances of my kid either getting monkeypox or even COVID?
I think it's great for parents to sit down and talk to children about the way infections are spread. A lot of them through the air, so tell the kids if you see somebody coughing, sneezing, stay away from them. Close contact, you can spread infectious diseases, so get rid of the hugging, the high fives, no more wrestling on the school grounds. Also, washing, disinfecting your hands is very important. If there are areas of your community that have a lot of COVID right now, masking does work for children. If you have a nice fitted mask, it can make a big difference. And I'm concerned that only half of school-age children that are eligible for a vaccine have had one. Opportunity there to help slow the spread of the vaccine by more vaccinations.
Yeah, and of course, we got flu season around the corner as well. Dr. Winter, we've got a great question about monkeypox from a viewer. Our viewer, Jim, wants to know, if you had the smallpox vaccine as a child, does that give you any protection against monkeypox?
Yeah, there's a lot of evidence that that probably does work. They're very, very similar. Not a lot of cases to know for sure, but the older folks who all got smallpox vaccination, looks like they're doing pretty well. It's the younger folks that tend to get this, but there is some cross-contamination or cross-benefit, I should say, for smallpox and monkeypox.
Okay, now, a week ago, when you and I talked, the World Health Organization called this a public health emergency. Now the Biden administration has followed. What does this declaration really mean or accomplish?
Well, it's a welcome declaration. We've struggled with monkeypox with supplies. The Federal Health and Human Services Department says it's going to open up a lot more resources so we can actually get treatment, testing a lot easier right now. Physicians have struggled, so this is a welcome declaration.
I want to just get to the latest on COVID. What are the numbers looking like? I mean, you know, again, we've got parents, teachers, students heading back into the classroom, back into workspaces and co-working spaces for a lot of people. What are we anticipating here?
Yeah, I'm concerned about this quite a bit, Sonia. COVID is still going up. It's not plateaued yet. The only good news is compared to previous strains, we're seeing less hospitalization, less deaths, but there's a lot of COVID out there. So as kids start to congregate together, as cooler weather comes, another concern in a couple months perhaps, we may see more spread. I think they're likely to see more spread. So we need to take precautions now. Think about that. If you hadn't been vaccinated recently in the last 5 months, you might want to consider that. New vaccines coming. I can't wait to see those. Hopefully they'll be out in September. But yeah, COVID's out there and it's not going away anytime soon.
Okay. Dr. Winter, thank you for that information. Good to see you as always.